possible preparation is again Paritaha study. Paritaha study, that is Paritaha Adhyayana, complete study of Charaka Samhita, complete study of allotted syllabus is the ideal and expected preparation mode. But then there will be certain aspects connected to the exams, particularly from the clinical standpoint. Some things will be more important. From the applied aspect point of view, something will be more important. Some messages are there which are just to understand and not to apply. Like that, the Samhitas would be carrying many information, and therefore what specifically need to be stressed is something that will be looked after. But when it comes to exam creates a sense of fear amongst the students. This is quite common because this is a test, and this is a test which will assess whether you are going to go forward or stay there itself. But in reality, in the education system, this is a precarious student situation of a student. Now, I as a teacher want every student of mine to excel. So I'll be exerting pressure, and the pressure is coming to you from my subject, from other teachers also. This is because my HOD is putting pressure on me, or my principal is putting pressure on me, and all that has to come on the student itself. So what the message is, in the entire learning setup, the student is the key. Where we want to change, the change has to occur in the student's behavior. And the student's behavior will change once he understands the subjects and internalizes and adopts them. So that is the whole purpose of any activity. So going forward, what will be occurring in this session, what we'll be learning in this session is, we'll be learning the significance and framework of Indriya Sthana and Nidana Sthana. We'll be talking about the division of marks for Indriya Sthana and Nidana Sthana among the 100-mark question paper. To what extent the Indriya Sthana will attract the number of questions, and to what extent Nidana Sthana will attract the questions relevant to the number of marks. And we will also talk about what are the likely questions, what may be the likely questions, or what can be the probable questions also. And we will also talk about how should be our approach to any answers. How should we approach the questions and how should we write the answer? And we'll be spending around 5 minutes on the tips and tricks as far as the multiple choice questions are concerned. So these will be discussed in today's presentation. So going forward, first, let's look into what is. So let me make a mention here is we'll start with Indriya Sthana and come to Nidana Sthana, because Indriya Sthana is smaller and brief, and thereby I can cover it in less time. So we'll talk about Indriya Sthana first and come back to the Nidana Sthana. Now, when we talk about Charaka Samhita, we know Charaka Samhita is a complete book which is talking about Chikitsa. And Indriya Sthana is one sthana where a student would learn ideally after learning the Sutra Sthana, Nidana Sthana, Vimana Sthana, and before studying the Chikitsa Sthana. Now, why it is important where it is placed is because we know that whether we follow medical science or not, we have Purusharthas to deal with. And Purusharthas are Dharmartha Kama Moksha. And one of the Vaidya Dharma happens to be giving the care to the patient. Dharma for a physician is to give care to the patient, to help the patients to regain their health. So therefore, the Vaidya Dharma is said to be Nahi Jivita Danadihi Danyad Anyad Vishishyate Paro Bhutadayam Dharma. The greatest dharma that I can do is Bhutadaya. That is, I have to be compassionate towards the patients. So therefore, the Vaidya Vritti has been framed as Maitri Karunyamarteshu Shakye Pritihi Upekshanam Prakritisteshu Bhuteshu Vaidya Vrittihi Chaturvidheti. That is, I have to see a patient with a compassion, I have to see a patient with friendliness. I have to engage only those patients in whom I can be confident that I can cure. And in all the patients where I deem that I am not in a position to handle, or my medicines, or my clinic, or my hospital is not in a position to handle, I should properly refer to the appropriate centers. So, upekshanam prakritiseshu bhuteshu, and someone who is going to die because of an asadhya vyadhi, he also should be given a cautious, or he should be well educated that the chikitsa has got a very limitations. So this should be the vritti, the attitude of any physician. And we also